By using a microscope, we can examine something more closely for the finer details that help us understand what we're seeing. In much the same way, a NASA invention called the Hilbert-Huang transform, or HHT, helps researchers who collect copious amounts of data better understand what they're investigating. One of the most important mathematical discoveries in NASA history, HHT is specifically designed to analyze nonlinear and non-stationary signals. Useful in many applications, it helps analyze data from wind tunnel tests and tests on shuttle tiles, and also aids in the search for planets and black holes. DynaDx Corporation of Mountain View, California, purchased exclusive rights to HHT from NASA's Goddard Space Flight Center in the first ever sale of a government-owned patent license during a public auction. Among tools for analyzing data, HHT is unique because it can be used to study complex non-stationary and non-linear data.
In real world, a lot of real-time series, physiological data, stock data, climate change data, all of them are non-stationary and non-linear.
The firm soon developed DynaDx, a software platform to support HHT, making it easier for users to do analysis.
We want people, when they analyze, time-varying signals, they can sort the result immediately. And they don't need to have any programming languages. They don't need to understand data processing mathematics. They can just drag and drop the data processing blocks. Once they finish the graphical diagram for their data analysis task, and then they can visualize the result immediately.
For the medical field, the firm used HHT to create multimodal pressure flow, or MMPF, a technique for analyzing cerebral autoregulation. Autoregulation is the ability of the blood vessels in the brain to maintain a constant blood flow despite changes in arterial blood pressure, and to redistribute blood to active areas that need more supply.
When it's impaired, you do not regulate perfusion, which is a blood flow in the brain, and you actually, with every activity, you need to shift blood volumes from areas that don't need it to the areas they need it more.
Dr. Novak and her team want to use MMPF to identify patients with autoregulation impairment who may be at risk of mental decline, and also in acute care settings where they would be able to predict changes in a patient's status before they decline clinically.
The idea is to have an easy-to-use technology that is not invasive and can be used for the triage of patients.
DynaDx has applications beyond the medical field too.
It can be applied to structural damage detection. Let's say bridge. By analyze the vibration data of the bridge, we can find how health of the bridge is and then predict are there any failures.
Today, people around the world are using this software platform built on a NASA technology sold at auction to help get a closer look at their data.